Hello everyone, welcome to my channel. Today I'm going to explain about flap designs from Periodontics. And in case you're following my channel and you like the content of the dental subjects or science in general, please do like, share and subscribe. And also let me know, give me a feedback on like how I'm explaining and if you're able to absorb the topic well. So let's get started. So today first, I'm going to explain about flap design. And before that, why do you really, what is this flap exactly? Like, for example, if you have a pocket, okay, and there's a lot of bacteria accumulation and it's too deep, then what would you do? You will try to make sure that you get access so that you can clean it up, so that you can make the tooth free of the bacteria. So to do so, you'll make sure that you will cut that part of the gingiva so that you can get access. Okay. So here, for example, they have made incisions so as to open it up like an envelope so that they can have better visibility. All right. So how do you think the design should be there? Wider base should be there to ensure adequate blood supply, or else there would not be adequate blood supply and it can lead to necrosis. Now, if there is any bony lesion, you cannot give an incision over the lesion. You have to give a little bit above the lesion. All right. Next, you have to give vertical releases at the line angles, and you should make sure that the corners are rounded, and you should make sure to avoid all the vital structures. And even though, like, for example, in this situation, I told you, like, suppose you clean up till here and make sure that the patient's teeth is clean and there's no plaque anymore. But once if he goes home and he does not maintain a good oral hygiene, again, there would be an accumulation, right? So how much the procedure is important, equally post-op plaque control is very important. Next, we have flap thickness. We have two kinds. One is split or partial thickness mucosal flap, and another one is full thickness mucoperiosteal flap. Here, the split means it does not include the periosteum, whereas full thickness, it means it includes the periosteum. Okay, so here gingiva and submucosa are involved. Here gingiva, submucosa, and periosteum is involved. Here, exposing the bone is not really necessary in case of split thickness flap, whereas in full thickness flap, it is necessary. Exposing the bone is necessary so as to get better access in case of osseous surgery, which we'll be seeing it later in this topic. So another thing to remember is 1 mm of bone resorption and remodeling is expected when alveolar bone is exposed. So suppose you are exposing the bone, then you can expect that 1 mm of bone resorption can be seen. Okay, and papilla preservation, I'll be discussing about this also. Split the papilla in case of a conventional flap and preserve it in case of papilla preservation flap, which I'll be discussing later. Now we're going to talk about periodontal pack. So an important thing to remember is it contains zinc oxide eugenol. So you might think that there might be some soothing effect. It is a healing agent, but it is not. So it's very important to remember that this periodontal pack does not help in healing. It is only used to protect the surgical wound. So it is only used for protection of surgical wound, but it is not used for healing. Okay. Next, coming to gingival surgery. So gingivectomy and gingivoplasty. So ectomy means completely excision, whereas plasty means just giving a little bit of incision. So if there are any suprabony pockets or gingival enlargements, gingivectomy is done. And if there is like little bit less invasive procedure is gingivoplasty, but the healing for both is by secondary intention. Now here you can see gingivectomy means removing the whole whole gingiva to get access and better visibility. Whereas here, you're not excising the whole thing, you're just removing a particular part so as to get access and visibility. Okay, now coming to distal wedge. This is mainly example. Suppose you think like you have a lot of plaque accumulation in your molars, third molars mainly, let it be maxillary or mandibular. The tissue surrounding it is very thick. So, it's really not possible to make sure that you remove all the plaque as easily as you remove for the other tooth. So how do you reduce pocket in that of the maxillary and mandibular teeth? So in maxillary molars, what do is you give parallel incisions. So pocket reduction distal to terminal molars. So you give a distal wedge. In case of maxillary, you give parallel incisions, whereas in case of mandibular, you give V-shaped incisions. Okay, so full thickness flap with V-shaped incision can be seen in this mandibular picture, whereas in maxillary, you make sure that you give parallel incisions. Now coming to mucogingival surgery. So what happens exactly, like what is this free gingival graft, what is this connective tissue graft? Suppose here on the above my picture, you can see like two diagrams. I don't know if it's clear or not, but let me tell you. Preferably, if you want a flap, like for example, not flaps, graft. For example, suppose here you can see that root is exposed, right? So you want to cover it, all right? So that then from where will you get the graft? So there are different things where if you get a graft, you can get a graft from your own body. And if you're doing so, the preferred place is palate. Okay, so you take a part. So here you can see this part is being taken out. So free gingival graft means there is no nourishment below this. So I take this part and leave it like this outside and then retransfer it to the site where I want to place it. Here you can see it has been placed and sutured, and later it will grow over and then it will be looking more like the whole place will be covered. So free gingival graft means it is a widened band of keratinized tissue, like this is an example. Connective tissue graft is mainly used for root coverage. Now freenectomy, frenotomy. Freenectomy means it is complete removal of frenum, whereas frenotomy means incision of frenum. And vestibuloplasty means deepening of the vestibule. Okay, so coming to free gingival graft. Graft is transplanted without a nourishing blood supply, so it can undergo revascularization. Like I told you, from the palate, a part is taken in, and that free gingival graft is not having any nourishing blood supply. So it will have its own and it will revascular when it is placed in wherever you wanted to place it. Now, connective tissue graft is we take the inner connective tissue only and not the epithelium. So it is less painful for the patients during the healing. And for both the free gingival graft and the connective tissue graft, the preferred site is palate. Okay, so let me just go over it again. So now here in this first diagram, you can see over here, this is nothing but flap is nothing but you are cutting it and opening it so that you have a good access, right? You can easily imagine it more like an envelope. And why are you opening? So that like you can have more access, and if there is any problem, you can fix it. Now, how should the design be there? It should always have a wider base. It should always have a wider base so that there is adequate blood supply, and it should never be done over the defects. And always make sure that you are not destroying any vital structures, and post-op plaque control is really important. And there are two kinds of flaps. One is split thickness and one is full thickness. Split thickness, it does not include periosteum. Full thickness does include periosteum. And 1 mm of bone resorption and remodeling is expected whenever alveolar bone is exposed, like in full thickness flap. Now, periodontal pack consists of zinc oxide eugenol, and it does not help in healing at all. It is only used to protect the surgical wound. Gingival surgery, gingivectomy, gingivoplasty. So Gingivectomy is excision of gingiva, and gingivoplasty is also, but then gingivectomy is more severe as compared to gingivoplasty. Here you can see how much of the gingiva is removed in case of gingivectomy, versus gingivoplasty. Now, distal wedge, if you have to reduce pocket reduction in the maxillary molars or the mandibular molars, in the maxillary molars, you give the parallel incisions, whereas in the mandibular molars, you give the V-shaped incisions. Okay, so full thickness flap with parallel incisions is called as nothing but distal wedge. In maxillary molars and in mandibular, it is full thickness flap with V-shaped incisions. Now, mucogingival surgery, free gingival graft does not have nourishing blood supply, and connective tissue graft is usually used for root coverage. Now, for both the grafts, the preferred place is palate. Okay. And frenectomy is complete removal of frenum, and frenotomy is incision of frenum. So again, frenectomy is more, it's a more, to be more precise, gingivectomy or frenectomy is excision of a particular part, whereas just an incision is frenotomy or like gingivoplasty and other procedures. So that's it for today. I hope you have understood, and in case if you want me to make any particular video, please do let me know in the comments below, and if you want slides, please do let me know so that I can share it with you. And thanks for watching, and stay tuned to my channel. Thank you.